Yes, we have now presented here at this meeting the long-term follow-up of a clinical trial that was, in fact, the preliminary data that went through the IMROS trial with Isa-VRd followed by Isa-RD in patient non-transplant eligible. In this trial, we included 73 patients with a median age of 71. It's important that we have two cohorts that we consider important. One is that we have 20% of patients that are over 75 years old, which I think is an elderly population. And also we have some patients that are could be candidate for transplant that they didn't have an immediate intent for transplantation. The data in this quadruplet, as I said, the first time this quadruplet was carried out in this population, Isatuximab VRd was quite good, with almost 100% of patients achieved a VGPR or better, a very good response. And very interestingly, over 55% of them have MRD negativity. And this also applies for the elderly patient population over 75 years old. And I think that's also very good data. In terms of PFS, the majority of patients are doing fine. We have, in the overall population, we have over 70% of patients alive and free of progression at 5 years, which is also, I think, good and in line, even a bit better, as we said in the randomized trial. And this is also similar, maybe a bit lower for the 75 years or older patients with 4 years of progression-free survival. In terms of safety, this could be a concern for this elderly population, but also the treatment was well tolerated with, of course, infections that are well managed in this patient population with dose reduction and all the antibiotics and the preventive measures.